Hello and welcome to Alta Rancho Pet and Bird Hospital. I'm Dr. Schufer, and I'm going to go through this presentation with you about information we feel is important for you and your new puppy. Please sit back and enjoy the presentation. There'll be plenty of time for questions when we see you in the examination room. The goal of this presentation is to familiarize you with the following: the purpose of the physical exam, proper care and feeding of your new puppy, nutrition, immunizations, internal and external parasite detection and control, sterilization, and our puppy health care program. The physical examination forms the cornerstone of good health. During the examination, the doctor will take a look at all of the different parts of your dog, starting with the eyes, looking for congenital defects, proper vision, signs of cataracts, etc. Then we'll check the ears using a video otoscope, which you'll be able to watch on the television monitor, checking for mites and signs of infection. We'll look into the mouth, looking for physical abnormalities such as cleft palate, malocclusion, improper tooth formation, etc. Next, we'll look at the heart. With a stethoscope, we'll listen to the chest for murmurs and arrhythmias. We'll also evaluate the respiratory tree, checking for cough, bronchitis, or pneumonia. We'll move down to the abdomen and palpate for hernias in both the inguinal and umbilical regions. We'll check for masses, abnormally shaped organs, and/or constipation. Next, we'll look at the skin. We'll be checking for external parasites such as fleas and ticks. We'll look at the overall condition of the coat and skin, looking for indications of nutritional deficiencies, dandruff, or oiliness. We'll check for skin infections, which are fairly common in young puppies as well. As we move down to evaluate the muscles and bones, we'll be looking at the general conformation of your pet. We'll check for congenital abnormalities such as luxating kneecaps, limb deformities, open cranium. After we've completed our examination, we'll be able to discuss any abnormalities that we've found and talk about diagnostic and treatment options with you. At that time, you'll have an opportunity to discuss any questions that you might have about your pet's general health care or the problems that we've found during the examination. During puppyhood, we recommend physical exams every 3 weeks until your pet is 16 weeks of age. After that, a recheck at 10 to 12 months will let us make sure that your pet's body has matured properly. Annual exams are appropriate thereafter until your pet is 8 years of age, and then every 6 months or so, because pets tend to age more rapidly once they pass the 7 or 8 year mark. Let's move on to caring for your new puppy. Young puppies are just like children. They need plenty of rest. When they're up, they should be active and playful. If they seem listless, something may be wrong. When handling your puppy, always use 2 hands because you may drop them, and that could be a big problem. Keep your puppy on your property until we finish immunizations at 16 weeks of age to minimize the chance of infectious disease. If you have children, please be sure to supervise all child-puppy interactions. Even the best-meaning child may accidentally harm a puppy without even knowing it. When lifting your puppy, be sure not to pull by the tail or the limbs. It may lead to a broken leg or a dislocated tail. Try to minimize jumping to protect the bones and joints as well, particularly from high places like beds, chairs, or tables. When training your puppy, we recommend using the crate training method for potty training. It tends to be the most effective and will get your pet trained in the shortest period of time. Ear care plays an important part in your puppy's health care. In order to make cleaning the ears simpler for you and your puppy, try to play with your puppy's ears when they're young. This will help desensitize them to handling the ears and make them better patients for us to handle in the exam rooms. We want you to clean the ears once a week using a veterinary-approved product such as Vet Solutions Ear Cleaner or Malaseb Ear Cleaner. When you're cleaning the ear, we advise using cotton balls as opposed to Q-tips. Q-tips tend to pack the dirt down into the ear and cause problems. The ear canal is long and deep, and we allow the irrigation solution to bring the dirt and debris up to the surface so that we can evacuate it with the cotton ball. The actual technique is quite simple. We're going to fill the ear canal fully with our solution. Vigorously massage the ear canal for 5 to 10 seconds. Notice on the picture where our thumb and forefinger are placed, behind and in front of the ear canal, so that as you compress it, it agitates the fluid within inside the canal. After you've done the agitation, we gently squeeze the canal, bringing the fluid to the surface, and use a cotton ball to evacuate the debris. Repeat this process until the solution is clear and the ear smells fresh. We recommend microchip identification for all pets to help prevent the loss of your pet. All pets that are presented to the shelters or to emergency clinics are scanned to see if there's a microchip present, and if it's found, they can return your pet to you based on a central database. Microchips are inserted between the shoulder blades and tend to be no more painful to insert than a general immunization. Anesthesia is generally not required, and your pet can be returned to you in a matter of minutes. Nail trimming is a procedure that can be performed at home with the appropriate tools. If you're uncomfortable with this procedure, we can happily do it for you here at the hospital. If you get the appropriate nail trimmers, you'll be trying to clip just the clear portion of the tip of the nail and trying to avoid the red portion, which reflects a blood vessel and will cause bleeding if it's nicked. If your pet has black nails, then we recommend trying to clip just small amounts off the tips or use an emery board to file down the nails. In any event, if you're uncomfortable, just bring them in and we can have the nails trimmed for you. You should always have Quick Stop or some other styptic powder on hand in the event that you do nick the quick. This will stop the bleeding in a matter of minutes and allow you to move on to the next nail. When starting to train your puppy, we recommend using the Gentle Leader head halter and leash system. This system has been based on scientific research by behaviorists and tends to be more effective and more humane than chokers. We have a DVD or video training guide that can be used to help you learn how to use this system properly. Moving on to dental care, it's important that you pay attention to your pet's teeth in order to keep them healthy throughout your pet's life. We recommend that you do daily teeth brushing using an enzymatic toothpaste and either a finger brush or a regular toothbrush as seen in the picture beside us. Right now your puppy's teeth are baby teeth, but we want to get him trained to allow you to start brushing the teeth. So we'll begin with just the finger brush and maybe a little bit of the paste and get them used to it so that as they grow we'll be able to take care of the teeth appropriately. You can also use CET dentifrice embedded chews. There are rawhide chews that have dentifrice in them to allow the pets to use those as treats. They're low in calorie and they'll help keep the teeth clean. In addition, we recommend regular oral exams at least once yearly with the physical, and then the doctor will tell you when and if dental cleanings are needed, in which case we may have to anesthetize your pet in order to get the tartar off the teeth. Let's talk about nutrition. Puppies need to eat at least 4 times daily until they're 12 weeks of age. The smaller the puppy, the more frequently they should eat, and the younger the puppy, the same thing holds true. After 12 weeks, we can move to 3 times a day feeding until 8 months of age, and then twice a day for life. Without food at the appropriate intervals, pets tend to get low blood sugar or hypoglycemia, and in its worst case can lead to seizures. We recommend and stand behind the Hills Products Science Diet Puppy Formula, or for the larger breeds, the Large Breed Puppy Formula. Large Breed Growth Formula has been shown to reduce the chances of developing hip dysplasia by up to 30 to 40%. We'd like you to feed your large breed dog this food until they're 12 to 14 months of age. After that, we'll move on to more of a maintenance diet. When feeding, we want to give the food for 10 to 20 minutes and then take it up. This will help you with your potty training and also allow you to find out whether your dog has an appetite or not. We want you to clean the food dishes between each feeding, as the residue from the food leaves a place for bacteria to grow, which can be dangerous to your pet. And of course, make sure that there's always plenty of fresh, clean water and that you clean the water dish at least every day. When it comes to nutrition, we want to minimize the use of treats. We want them to eat dog food primarily, and if we're going to use treats, they should be used only in training circumstances. Do not give bones of any kind, because they will splinter, frequently get stuck in the animal's mouth or intestines, and sometimes have to be removed surgically. Try not to give table food, because this tends to spoil the pet, makes it more difficult to get them trained to eat dog food. Puppy vitamins are a good idea to add to any nutritional program. We have some available at the front desk, and you can inquire with the reception staff about them. Now we're going to move on to immunizations. Immunizations protect against infectious diseases. The most common ones that we treat for are canine distemper, canine parvovirus, canine coronavirus, and canine kennel cough complex, which is caused by parainfluenza and bordetella. We begin immunizations at 6 to 8 weeks of age and then repeat every 3 weeks until the pet is 16 weeks of age to ensure protection. When vaccinations are given at an early age, they're not always responded to by the body appropriately, and hence you may not actually get protection unless you have the boosters given at appropriate intervals. Sometimes immunizations can cause listlessness or overall malaise, just as when you get a flu shot. If it's mild, there's nothing to be concerned about. It will usually pass within 1 to 3 days. Rarely, allergic reactions can occur, resulting in hives, swelling of the face, vomiting, or diarrhea. Should any of these reactions occur, please call us immediately. And if we are not available on the weekend or at late night, you can go to the emergency clinic on Euclid near the 10 freeway. External parasite control is part of general maintenance for your pet. The common external parasites include ear mites, fleas, and ticks. The ear mite, as pictured in the accompanying diagram, lives in and around the ears. They're contagious to both dogs and cats, but not to people. Usually they cause quite a bit of itchiness, which can lead to ear infections from the constant scratching. We diagnose ear mites using our video otoscopes, as you'll see in the exam room, and sometimes by microscopic examination of ear debris. Once we find the ear mites, we control them through injections and topical. Fleas are probably the most common external parasite affecting dogs and cats. Fleas live on the pet and suck the blood. After they've had a blood meal, the female egg can lay up to 60 eggs per day, and you can see how quickly a flea population can increase within your house. Fleas also harbor the tapeworm eggs inside their body, and when your pet chews on the flea, they can get infected with tapeworm. Fleas can also transmit the plague bacteria, although in these days that's rather uncommon. Fleas are contagious to other pets and even to people. Fleas will bite people when they don't have dogs or cats to bite in the environment. Frequently, dogs will develop skin infections from chronic scratching related to the fleas, as noted in the picture beside us. This poor dog has lost all its hair because it's been scratching so much from fleas. Flea control is much simpler these days with the advent of drugs like Frontline. Frontline Plus is either put on as a spot-on or a spray-on, and each application lasts 1 month. It won't wash off, and even if the dog is swimming. In order to be effective, we need to treat all the pets in the house, because one pet that is untreated can act as the reservoir for fleas in your environment. It's very safe, and it's very... If your pet has fleas, then you unfortunately have fleas in your environment as well. In order to control them, we like to use foggers or premise spray, which include products that will kill the eggs as well as the adults. When treating your pets with Frontline, a single treatment to the premise will usually be enough to get rid of the flea population in your environment. Ticks are another common external parasite that are of concern. They suck blood from the pet as well. They're contagious to pets and to people, and they transmit multiple diseases, including Lyme's disease and other ones such as Ehrlichia and Rocky Mountain spotted fever. They are controlled, fortunately, with Frontline Plus, so a single application will take care of both your flea problem and your tick problem. Now let's move on to intestinal parasites. All pets are subject to parasitism from roundworms, hookworms, whipworms, coccidia, and giardia and tapeworms. Now let's talk about intestinal parasite control. Intestinal parasites live within the GI tract and steal nutrients from your pet. On the right is a picture of a hookworm, and they will hook onto the intestinal lining and suck blood and nutrients right out from it. Symptoms of parasitism include poor coat quality, pot-bellied appearance, diarrhea, and sometimes vomiting. Parasites are communicable to other pets, and they're usually transmitted through the ingestion of feces. They can even be transmitted to people, in particular children who are walking around in areas where the dogs have gone to the bathroom. In order to diagnose this, we can either visualize the worms in the stool, which is only common in tapeworms or roundworms, or we do a microscopic stool examination looking for eggs. This picture on the right shows a roundworm egg, which tells us there are roundworms living inside of the body. For Giardia detection, we have a commercial test that can be run in 4 to 5 minutes in the hospital. The treatment of internal parasites depends on the individual parasite that we find. There are specific drugs for each different one. For prevention, it's important to clean up stool immediately after the dog has gone to the bathroom. This eliminates the possibility of them re-ingesting the stool and reinfecting themselves. We give Interceptor, which is a drug that will prevent roundworms, hookworms, and whipworms by simply giving it once a month. It's an easily digested, chewable pill. The dogs like it, and it's easy to administer. We control fleas in the environment using Frontline to prevent tapeworm ingestion. Heartworm is another disease that plagues dogs. It's a worm that grows up in the blood and the blood vessels and the heart. It's transmitted to the dog by mosquitoes. Once the larvae migrate into the heart, they grow into large worms, which can cause heart failure and death. If you detect heartworm disease once it's already established, it can be treated. However, the treatment is both expensive and sometimes dangerous to the dog. The detection method is a blood test. It takes about 5 minutes and just a few drops of blood. It can be done in our office at any time. Prevention is achieved by using Interceptor tablets once monthly. Sterilization is an issue that is controversial in some people's minds, but in general there are many good reasons to perform it. First, it reduces the chances of breast or prostate cancer by tenfold in a pet who is sterilized before they reach the age of puberty, which is approximately 6 months of age. It eliminates the chance of infected uterus, which is a common problem in older dogs, known as pyometra. And it helps prevent the destruction of unwanted puppies, thousands of which are put to sleep every year right here in San Bernardino County. Sterilization surgery is usually performed between 16 weeks of age and 6 months. We recommend preoperative blood testing before surgery to reduce any anesthetic risks. We do employ the safest anesthetic agents available, including isoflurane gas and sevoflurane gas. After the surgeries, we like the pets to stay in the hospital overnight so we can evaluate the surgical site the day after. They're discharged with pain medication and Elizabethan collars to protect the wounds. Activity is restricted to leash walks only during the recovery, and we remove the sutures in 2 weeks. We've developed a puppy healthcare program to help make sure that your puppies get off to the right start. Basically, they provide all of the services we've been talking about at a 20% discount to you. In addition, you save 10% on sterilization surgery when the time comes. The included services in the puppy healthcare program are physical examinations, which are given every 3 weeks between the ages of 8 and 16 weeks, a stool examination to check for internal parasites, an oral deworming in case we have worms that are not detected in our parasite check, and immunizations, which are repeated again in boosters every 3 weeks until the pet is 16 weeks of age. In addition, you receive a free bag of puppy food as a trial from Science Diet. It's important to understand that this is not an insurance program. Only the services listed above are included in our puppy healthcare program. If there are problems associated with trauma or accidents or other illness, they're not included in the cost of this program. We've discussed quite a few different products and services that are going to be required for your puppy to remain at his or her best. And we thought it would be good to summarize them on one slide, the things that we think are important for you to take home with you today. First, Vet Solutions Ear Cleaner, so that you can do your routine weekly ear cleaning. Frontline Plus for flea and tick control can be dispensed. And because your pet is growing, we may dispense just 1 month supply at a time, and then as they grow, we'll get the appropriate size for you. Same thing goes for Interceptor, for heartworm and intestinal parasite control. The Gentle Leader head harnesses available come in different sizes. Your puppy may be a little too small right now, depending on their age, to use one appropriately, but you can take a look at them, and as they grow into it, we can pick the appropriate size for you. The training video, of course, would be appropriate to take home with that. If you're going to be planning to trim your own pet's nails, Quip Stop styptic powder is available for you, so you won't have any bleeding problems at home. Science Diet Puppy Diet, or large breed formula depending on the size of your dog, can be taken home in a small trial size bag. All the Science Diet products are fully guaranteed, so if your pet won't eat it for any reason, you can return it for a full refund. And then, of course, some puppy vitamins would finish off the nutritional program. We thank you for your time. We hope you found this presentation informative and enjoyable. A technician will be with you in a few moments to answer any questions you have and prepare you and your puppy for the doctor's examination. We look forward to seeing you in the examination room.